Here we'll draw the ear in coronal perspective, with the subject facing towards us. So show the 3D planes, superior inferior, medial lateral, and anterior posterior. We include in this diagram an insert to show some of the more complicated ear anatomy, which we'll not attempt to draw. Draw the outer ear, then draw the external ear canal, which extends through the tympanic portion of the temporal bone just in front of the mastoid process. Next, draw the tympanic membrane. Now draw the middle ear canal, which also lies mostly within the tympanic portion of the temporal bone. Indicate that from lateral to medial it contains 3 ossicles, the malleus, incus, and stapes, which are Latin for hammer, anvil, and stirrup, respectively. Indicate that the stapes abuts the oval window. When sound is transmitted through the ossicles, the stapes pushes the oval window into the inner ear canal. We remember the orientation of these ossicles with the acronym MIS. Opposite to the oval window, draw the round window. Next, show that the eustachian tube extends from the middle ear into the nasopharynx, which allows your middle ears to equilibrate with the atmospheric pressure in your nasopharynx when you swallow. 2 important muscles exist within the middle ear canal, the tensor tympani, which is innervated by the trigeminal nerve and which acts on the tympanic membrane, and the stapedius muscle, which is innervated by the facial nerve and which acts on the stapes. Auditory abnormalities and Bell's palsy are often ascribed to stapedius muscle inactivity. Next, let's draw the inner ear canal, which lies within the petrous portion of the temporal bone. We draw it in 3 different parts. First, sketch the semicircular canals, which lie in superolateral position and serve vestibular function. Then draw the cochlea, which is shaped like a snail's shell and lies in anterior-inferior position and serves auditory function. Lastly, label the vestibule, which lies in between the cochlea and semicircular canals. It transmits sound waves from the oval window to the cochlea and contains the otolith organs which provide vestibular cues. Draw the cochlear duct, then label the vestibular duct, which is continuous with the vestibule, and next label the tympanic duct, which ends in the round window. Hence, the round window is also called the secondary tympanic membrane. Denote that Reissner's membrane separates the vestibular and cochlear ducts. Denote that the basilar membrane separates the cochlear and tympanic ducts. And denote that the vestibular and tympanic ducts are filled with perilymphatic fluid, which is high in sodium and low in potassium, much like extracellular fluid. Then denote that the cochlear duct is filled with endolymphatic fluid, which is high in potassium and low in sodium, much like intracellular fluid. Denote that Meniere's syndrome, bouts of vertigo, low-frequency hearing loss, and ear fullness is thought to be due to pathologically elevated endolymphatic sodium concentration, so it's commonly treated with salt-wasting diuretic medications. Now let's address what occurs when a sound wave is detected. Indicate that when a sound wave enters the external ear canal, it vibrates the tympanic membrane. The tympanic membrane then transmits the wave through the ossicles, the malleus, incus, and stapes, and the stapes strikes the oval window. When the oval window vibrates, a fluid wave passes through the vestibule and the vestibular duct. Show that the vestibular and tympanic ducts connect at the apex of the cochlea. This is also referred to as the helicotrema, and that the sound wave passes across the apex into the tympanic duct, through the tympanic duct, and then pushes the round window into the air-filled middle ear canal. In this process, the auditory sensory organ, the organ of Corti, which lies along the basilar membrane, is activated for sound detection. To note that high-frequency sounds activate hair cells at the base of the cochlea, near the oval and round windows, whereas low-frequency sounds activate hair cells at the apex of the cochlea. The basilar membrane is thinnest at its base and widest at its apex. Now let's learn about the major vestibular components of the ear, the otolith organs and the semicircular canals. Within the vestibule, indicate the saccule, which detects vertical movement, meaning gravity, and the utricle, which detects horizontal, forward-backward movement. Finally, shade in the semicircular canals, horizontal, posterior, and anterior. They lie perpendicular to one another and detect rotational acceleration, which we address elsewhere. Finally, draw the vestibular and cochlear segments of the vestibulocochlear nerve. This concludes our diagram.
Medical Surgical Nursing 2, Unit 1, which is from third year BSc Nursing, and this is nursing management of patient with disorders of ear, nose and throat. This is the syllabus for third year BSc Nursing, Medical Surgical Nursing, first unit. This is nursing management of patient with disorders of ear, nose and throat. So all these you need to know. External ear deformities, middle ear, inner ear. Remaining syllabus for unit 1, speech defects and speech therapy and all these things. Nursing assessment of ear, which is very important. So first you need to inspect the external ear before examination with an otoscope and oriscope. Size and shape of pinna, you need to take the measurements. And third, that is signs of trauma to the pinna. And fourth, suspicious skin lesion on pinna, including neoplasia. Fifth, skin condition of pinna and external canal. Sixth, infection or inflammation of external ear canal with discharge. Nursing assessment of nose. So first, that is size and shape. Second, obvious bend or deformity you need to check. So third, that is swelling, scars or abnormal creases you need to check. Fifth, that is redness, which includes evidence of skin diseases. Discharge or crusting from the nose. Offensive smell from the nose. So nursing assessment of throat. First, you need to examine the mouth and the condition of the tongue. Examine back of tongue and tonsils. Palpate the base of tongue. Look for tumors that may not be easily visible. So fourth, inspect the vulva and soft palate. Fifth, inspect the hard palate.
This is Bob. Bob has a hearing problem and it's up to us to figure out what's going on. There are two important hearing losses to consider. Sensory neural, which means there's something wrong with the auditory nerve or the cochlea, and conductive hearing loss, when there's a problem with sound passing to the inner ear. We can use two tuning fork tests called Weber's and Rennie's tests in order to figure out what's going on. First up, we'll need a 512 Hz tuning fork, and we're going to start with Weber's test, but it doesn't really matter which one you start with. We strike the tuning fork so it starts vibrating, and then we're going to place it in the middle of Bob's forehead. We're going to ask him which side the sound is loudest. Now normally, the sound should be equal in both ears. However, if there is an abnormality in any of the ears, the sound will lateralize. This can mean one of two things. Either there is a conductive hearing loss in the ipsilateral ear, or there's a sensory neural hearing loss in the contralateral ear. Ipsilateral just means the same, and contralateral means the other. Now we can move on to the Rennie's test. We need to strike the tuning fork and hold it on Bob's mastoid process. We need to ask him if he can hear the sound and then to tell us when he can't hear it anymore. This will measure bone conduction. Once he stops hearing the sound through the mastoid process, we need to move the tuning fork right next to his ear. This will measure air conduction. In a normal situation, Bob will say that the sound was louder when the tuning fork was next to his ear than when it was on the mastoid process. Rinne's terminology is a bit different. A normal test, i.e. where air conduction is louder than bone conduction, is known as a Rinne's positive test. An abnormal test, on the other hand, where bone conduction is louder than air conduction, is known as a Rinne's negative test. So let's put the two together. We know when we did the Weber's test, Bob said it was lateralizing to this ear. That means either that ear has a conductive hearing loss, or the other ear has a sensory neural hearing loss. Now we can do the Rinne's test. So, we need to take the tuning fork, place it on Bob's mastoid process, ask him when he can stop hearing it, and then place it next to his ear. Since Bob is saying that the sound was louder when it was on his mastoid process than when it's next to his ear, it means that bone conduction is better than air conduction, meaning there's a conductive hearing loss in this ear. We'd also repeat Rinne's on the other side to check it's normal. If Bob had had a normal Rinne's test, also known as a positive Rinne's test, where the air conduction is better than bone conduction, it would mean that the other ear has.
Examine the buccal area and the gingivolabial, and that is gingivobuccal sulcus, the space between the cheek and the gums. Examine the floor of the mouth. Check for submandibular duct, stones or masses. So 8, that is last one. Examine the nasopharynx and larynx with a mirror or flexible fiberoptic nasoendoscope. So you need to examine, then palpate and check the tongue and inspect, then examine. So usually you need to know the anatomy of mouth. So usually ENT anatomy you just need to refer, which will be very helpful for you to know what is hard palate, soft palate, vulva and all. So this is Weber's and Rinne test. External ear. So in this you need to learn about otalgia. So what is otalgia? Oto means which is ear, algia is pain, which is a post prefix. This is an example of otalgia. This is ear pain. In middle ear you just, that is impacted wax. So for example, this is the impacted wax which is present in the middle of the ear. Tympanic membrane perforation. Perforation meaning is there is a hole. It might be anywhere. But here in tympanic membrane there is a perforation, rupture, is hole. What is otitis media? Oto is ear, itis is inflammation. So there will be inflammation in the otitis region. So this is normal middle ear and this is otitis media, where there will be inflamed region you can observe in this. What is otosclerosis? You just need to refer what is otosclerosis because it's not much important, but you just need to know what is. So otosclerosis is nothing but where there will be degeneration of your that is your bones and all will be degenerated. That is an inherited disorder that causes hearing loss due to ear's inability to amplify the sound. So there are three bones, that is this is malleus, okay, this is incus, this is stapes, okay. So where all these three bones help you to amplify the sounds which is coming from this region, from ears, and this passes through this region. This is middle ear. So when someone has this condition, that is otosclerosis, one of the bone in these three bones, this malleus, incus and stapes, in one of the bone is unable to vibrate freely, so which causes otosclerosis. So auto is ear and sclerosis is nothing but abnormal hardening of body tissue. A condition is caused by abnormal bone remodeling. You can see here bone remodeling in the middle ear. What is mastoiditis? It's nothing but inflammation of mastoid bone. So in this region back of the ear, behind the ear. In inner ear, you just need to know what is Meniere's disease. So I will be taking another part for this unit, where I will be explaining you definition and etiology and all the diagnosis and nursing management of Meniere's disease, which is very important in exam point of view for 15 marks. So this is normal ear and this is hydrops. You can see in Meniere's disease, the inner ear disorder that causes episodes of vertigo. So that is nothing but spinning sensation for the individual, and ringing in the ears. It's nothing but tinnitus, tinnitus, and hearing loss will be there, and there will be a fear of fullness. That is, they'll be like having a sensation of fullness in their ear. There is congestion in the ear. The Meniere disease usually affects only one ear. What is labyrinthitis? So you just need to know what is inflammation of inner ear. Inflammation of inner ear or the nerves that connect the inner ear to the brain. So labyrinthitis is usually triggered by an infection such as cold or flu. So in this region there will be inflammation which will lead to abnormal hearings. What is ototoxicity? So there's nothing but, so whenever we prescribe a drug to any individual, he will be having some toxic signs and symptoms which will be showed by the individual for the drugs. For example, I'm saying we are prescribing an individual dexamethasone, so which causes ototoxicity. Fine. Upper airway infection. You just need to know what is upper airway infection, lower airway infection. First one, sinusitis, which is very common in individuals. So you can see this is healthy human being image in the left side of the video. This is maxillary sinus and this is ethmoid sinus on the nasal septum region. This is frontal sinus on the forehead, frontal. This is ethmoid and maxillary. So what happens, all these sinus region is normal now here, flesh, red fleshes, which will be thickened sinus lining. Because of this inflammation in the sinus region will cause some abnormal sensation which will be leading to some ENT problem. What is common cold? Usually everyone used to get common cold and all in the spring and winter season. Adenoiditis. So it's nothing but, you can see there will be inflammation of adenoids caused by infection. So in this region, adenoids are masses of lymphatic tissues. Lymphatic tissues are very much important, which helps immune system and that helps the body to fight against infection. So you can see another image. This is adenoiditis. What is quinsy, which is very important? Last two, I think before 2 years, this quinsy was asked in 2 marks question for 4th year BSc nursing in exam, final exam. So you need to know what is quinsy. Quinsy is nothing but it is a complication of tonsillitis, which the infection spreads behind the tonsil. This is tonsil region. Behind this is, yes, this region. So you can see another image. This is a quinsy or a peritonsillar abscess is among the commonest deep infection of adult head